Thank you, Danny. And thank you everyone for hanging in this afternoon. It's late on a Friday afternoon, snowy in Philadelphia, but I'm so glad you're here and I'm so delighted to be here. I want to extend my thanks to CTIP, to NPSC, to PACES Connection, and all the other co-sponsors for inviting me to be part of this amazing workshop and for organizing this fantastic series. So I was invited here today to speak about lessons learned from my work coordinating mobilizing action for resilient communities, MARC for short, and I'll get to that momentarily. But as so many people have said, this work begins with self. So I want to share a little bit about my journey and why I so passionately believe in the power of community networks. Now, some of you may know that I am a fan of the social justice activist, Margaret Wheatley, who said, "Whatever the problem, community is the answer." And these words really do resonate for me because both professionally and personally, I've had the opportunity to experience and witness the power of communities, their power to connect people, to help them heal, and to inspire them to confront and improve the conditions that challenge them. One of these experiences has been my work with community-based public health coalitions or networks, which actually began more than 30 years ago when I was a young social work intern in the Contra Costa County Health Department in California. And when I was there, I staffed several coalitions that were aimed at preventing specific health issues, such as smoking and childhood injury. And it was there that I really learned about the power of bringing people with shared concerns together and leveraging their collective vision to create positive changes. Fast forward about 20 years later, when I was formally introduced to the science of ACEs and all the ACE attributable poor health outcomes, the concept of trauma-informed practice and resilience. And then add another 5 years to that when I became a founding member of a local network, the Philadelphia ACE Task Force, that I began to really understand the even greater power these public health coalitions or networks could have when rather than being focused on a single issue, they were organized around the science of ACEs, trauma, and resilience. For shorthand at MARC, we've come to refer to these groups as ATR networks or ATRs, and I'll be using that acronym during the rest of my talk. Now, very recently, I came across another Margaret Wheatley quote that struck me as an even more accurate description of what I've learned about what makes ATRs in particular such powerful and potential levers of change. So my new favorite Margaret Wheatley quote is this one: "There is no power for change greater than a community discovering what it cares about." And I think my tagline for that would be, "And there is no power for a community discovering what it cares about greater than an ATR network." So why is that? Well, for the last 6 years, my colleagues and I have been learning about and from 18 ATR networks through our role as the coordinating organization for MARC. In that role, we facilitated a multi-year learning collaborative of 14 ATR networks. And I've heard a number of people put in the chat, we need a community of practice, and that's what we had. It was an incredibly rich and powerful experience. And we had support from the Robert Wood Johnson Foundation and the California Endowment to do that. And we also engaged in a very robust cross-site evaluation that was conducted by a research company called Westat. Also, as part of our MARC work, we recently conducted a survey of ATR networks with the National Opinion Research Center at the University of Chicago, better known as NORC. And in this study, we heard from hundreds of ATR networks across the country about their key characteristics, their accomplishments, their current goals, and technical assistance needs. And I'll talk a little bit about that study today, but if you want to hear more and it piques your interest tune in to our webinar about the survey, which is on Friday, January 31st. Unfortunately, it does not conflict with this series. So together, the deep dive from our evaluation and the snapshot from our survey have provided a proof of concept for us, demonstrating that ATR networks can help us better align, accelerate, and augment the community-driven solutions to ACE attributable poor outcomes that are already happening throughout the US. And I think a number of speakers have already talked about that communities have the solutions. What ATR networks are is a vehicle for really operationalizing those solutions. So it's not just about strong collaborative action. It's about a group with diverse experiences, perspectives, expertise, skills, and agendas coming together, realizing their commonalities through the science of ACEs, trauma and resilience, embodying the trauma-informed approach, centering prevention and healing, and operating accordingly. Operationally, this often means that ATR networks enable groups or people or groups who may have come with a single issue agenda to shift their focus and embrace the connections among them. A great example of this is a shift in the evolution of the Southern Kenai Peninsula Resilience Coalition from a group that was addressing substance abuse and domestic violence to one focused on the underlying issues of trauma as well as intervention and prevention. Now, several of today's speakers have referenced ACE initiatives or coalitions. Basically, for us, these are analogous to what we call ATR networks. And for us, there are a few defining characteristics that give ATRs their possibility and power for creating change. From our experience, these groups are successful when they represent a geographic community that's large enough to affect policy change at the legislative level. Many include that defining characteristic in their name, such as Peace for Tarpon, a small town network, Philadelphia ACE Task Force, a large city network, the Illinois ACE Response Collaborative, which is a state network, and Southern Oregon Success, which is a regional network. A second characteristic is that they're cross-sector, and several people have talked about that already. In our recent survey, networks reported participation from 32 of all of the from all 32 of the different sectors that we asked them about. Now, almost all of them reported engaging the partners you might expect in this work. 90% said they had representatives from social services, health, and education. But nearly 80% also reported having community members engaged. Nearly 60% had members from faith-based organizations in the housing sector, and nearly 40% had members from law enforcement, philanthropy, and business. Altogether, that's covering a lot of bases. And as you can imagine, this diverse representation is one of the elements that makes these networks so effective. While we didn't specifically ask about whether or not these networks included people who had been personally impacted by trauma and ACEs, we know this is imperative, and several people, especially Rebecca, have spoken very poignantly about that. And we believe it's most likely when there is a broad range of representatives in an ATR, especially when it includes community members. In November, Representative Ayanna Pressley said, "The people closest to the pain should be those closest to the power," in her remarks about trauma-informed policymaking. ATRs can and must be a vehicle for this. Another critical component of effective ATRs is that they clearly center ACEs, trauma, and resilience as their organizing principle. And evidence of this is often found in written materials about the ATR or in their mission or value statement. And in fact, here's an example of that from an ATR that our previous speakers involved in. Not only does it clearly articulate that the group has a focus on ACEs, trauma, and resilience, it identifies the geographic reach, and it suggests that the network is cross-sector. And finally, our last defining characteristic for being an ATR is that the network meets in person. Now, we know over the last 2 years, we've all learned that a ton of really good work can be done virtually. And we actually saw that value of the virtual connections for our ATRs even prior to the pandemic, because our national MARC Learning Collaborative met virtually most of the time. Nonetheless, there is absolutely no substitution for the magic that happens when people are in the room together. It is the most efficient and effective way to build connections and trust. This was clearly demonstrated when we visited each of our 14 sites and then attended their in-person ATR meetings. And this is a photograph from our visit to Alaska. And when we brought our learning collaboratives together for in-person convening. So I think that I probably share a hope that in 2022, we'll all be able to restore and resume this critical component of movement building. Our experience in MARC also has taught us a lot about how ATRs function, what they do, and what impact they can have. We created this model of key network functions based on our work alongside network leaders. I'm not going to go through each of these today because all of these functions were beautifully illustrated in the presentations that our panelists just gave of how their networks do the work, the incredible work that they're doing. Sorry, I skipped there we go. We also in our survey asked ATR networks about what kinds of activities they engage in. And you heard a lot about that also from our panelists. Since you can see from the survey on this slide, the range is broad and diverse, which is a good thing because many touch points are required to affect the change needed to create the healing and resilient communities we all envision. But what about impact? So far, I've been speaking about ATR network process, but we've also learned lessons about their outcomes. Our evaluator, Westat, used several tools to measure change over the 2-year period of our MARC Learning Collaborative. One of these tools was a social network analysis that measured growth in depth and breadth of connections among network members. So this slide illustrates that growth in one of our networks in the Learning Collaborative, and there were similar results across the whole collaborative. Now, some people might say growth isn't an outcome, but my colleague Claire Reedy, who's done a lot of work with community organizers, reminds me that in organizing, growth is an essential outcome because more people equals more power. Growth is how we mobilize for action. Westat also measured change using a methodology called outcome harvesting to explore networks' contributions to change at various levels. And Westat identified outcomes across the 14 sites in 6 areas: adoption of trauma-informed practices, that was the largest bucket, relationships, funding, and data, organizational policy, and even public policy. And at HFP, my organization, we were particularly gratified to see these outcomes in the public policy arena, as one of our goals was to encourage our ATRs in the Learning Collaborative to engage in policy work, and it happened over a relatively short period of time. This slide illustrates how the Alaska Resilience Initiative, ARI, contributed to a House resolution, which eventually became a very important trauma-informed policy, Senate Bill 105, which had very strong language about ACEs trauma and resilience in it. Our NORC survey, however, did suggest that there's still a lot of work to be done to help ATRs do policy work. Only 1/3 of the networks surveyed reported that they currently engage in policy and advocacy activities, and even fewer, 16%, identified policy and systems change as a top goal for their network. The good news, as we see it, is there's lots of opportunity for growth here, something that CTIP and others speaking today are really well positioned to do. Our contribution to building ATR capacity for policy work is our MARC policy toolkit, which was created especially for ATR networks. The toolkit demystifies the process of how ATRs can effectively lead, facilitate, and participate in policy work. And we include a broadened definition of what constitutes trauma-informed policies, as well as many, many ways that ATRs can engage in policy change work. So you can find our policy toolkit along with a rich and carefully curated set of resources on the MARC website. It has hundreds of stories in multiple formats by and about networks, along with a searchable database, very much like what Kelly was asking for, where you can put in terms that can be helpful to the particular needs for your network. For example, you might be a city-based ATR looking to engage more community members or interested in how ATRs are working with law enforcement. You can put in those search terms and come up with a set of resources and stories about how others have done that kind of work. So we hope you'll check that out. I want to say 2 things in closing. First, here's my call to action, which really echoes much of what Dan and others have said. If you are already part of an ATR network, thank you. I hope that what I've shared today will inspire you to grow and find new ways your ATR can create change in your community. If you aren't part of an ATR, find one in your community and join it. There are maps both on the PACES Connection website as well as on ours of local communities all over the country that have ATRs near you. And if you can't find an ATR near you, start one. We and everyone on this panel today is here to help. Lastly, you know I like quotes. I will end with one from another powerful woman, maybe one that you've heard before, but it deeply resonates for me and inspires me to continue to do this important work. Thank you.